Hi, my name's Dasha. I'm a friend of Fruzsi's, and in the last week, they've opened up to me about their really intense health issues at the moment. I work in public relations and as a freelance journalist, so I thought I would use those marketing skills of mine and help with a bit of a campaign to assist with some crowdfunding to make sure that they can afford to have shelter and food and look after their kitty while they're going through this really intense time with their health. So anyone who knows Fruzsi would know that they're a gorgeous, generous person who would help other people at the drop of a hat. So I think it's our time to step in and help them. So I'm really hoping that this helps to shed some light on the situation and help people understand what's been going on in their world recently. So Fru, do you want to tell me a bit about yourself and what's been going on?
Oh, good Lord. Firstly, thank you so much for doing this with me / for me, because as you know, I've been ailing in silence for over 4 months now and not reaching out because reaching out for help is just the hardest thing to do. So before I cry already, like straight off the bat, I'm going to clip it and answer your actual question in terms of who I am and what I do. I have the privilege of, well, previously having been a full-time artist, doing ceramics and painting / illustration. I really love having and running my own small business, which I had done for 12 years up till now, on and off, having had a gallery and stuff like that. But my main bread and butter in the lead up to COVID was teaching my creative workshops, both illustration and ceramic, and getting to travel with that to different states, to help inspire people and really make a great connection between therapy and art and how the two can really go hand in hand. So that was my main focus, as well as preparing work for exhibitions where I get to talk about the things that I'm really passionate about.
And can you tell me a bit about what's been going on lately for you for the past several months?
Yeah. I mean, it's actually a weirdly hard thing to talk about because I feel like there's really no one else talking about this. And that makes it really scary and really emotional, because it's really been a life-changing experience. But to answer your question more directly, ever since getting the first 2 doses of the vaccine, I've experienced a myriad. I've just counted 30 symptoms, ranging from really random to pretty tragic and scary. Since receiving the dose of the vaccine, the second one was in November of last year. So essentially it's been struggle town since November, December last year, going on 5-6 months now of just debilitating pains and weird symptoms that have not allowed me to work whilst I chase every possible avenue to find a solution and a diagnosis, or some kind of assistance for what's been going on.
Yeah. And what are your general thoughts about the vaccine? Like, because I know you're quite, I guess, a pro-science, quite rational person. So how does that kind of you being in this situation where you've been impacted by this so heavily?
That's a really great question, Dasha. A super pro-science. Like I obviously got the vaccine and believed that I should, and I understand the necessity for it. And my whole life, I've gotten every vaccine that was suggested to me, and never had a reaction to anything before. So I really didn't expect to have a reaction to this either. Obviously, I had a little bit of hesitation, as a lot of people do, but I believed I was doing the right thing, to keep the community safe, keep myself safe, and most importantly, on a personal level, to be able to travel to Hungary to see my grandparents, which is all I ever want to do. But now it's been 3 long years of not getting to see them. So that's a real point of pain for me. You can be pro-vax and still get a vaccine injury. The two things don't cancel each other out. And I'm absolutely not here saying don't get vaccinated. It's not a good thing, because I do believe in the vaccine and I am absolutely pro-science. All I'm saying is that there are people like me who have sustained a vaccine injury, and we just also need help.
So do you mind telling me a bit about your symptoms and how things kind of started to manifest for you?
How long have you got, my darling? How long have you got? Well, listen, maybe I should just say that, like, prior to getting vaccinated, at that point in time, I was training a lot. Like, I was training at the gym 5 days a week, had no medical history personally or in my family of like any heart symptoms, would hike on the weekends, run a million errands, because running your own business, you wear 1,000 hats and you literally have to do everything, your marketing, your production, your everything. Following the vaccine, I had a lot of like really quickly onset like cardiac symptoms, like racing heart, flip-flop feeling in the heart, and they call it like tachycardia, of like just a really irregular heart rate, which I'd never really experienced before. There's been, you know, a lot of broken sleep, because I'll wake up just feeling like my heart's pounding out of my chest. And that would happen maybe every 15, 20 minutes. So anytime you feel like you finally drift off into exhaustion, you're suddenly waking up and your beats per minute are just like going through the roof. God, I've had so many absurd smaller symptoms like tingling arm, headache, heart pain, change in my period, like thinning of my hair, like fatigue that has been next level and scary. I also understand that right now I'm speaking to you and I sound like active and like well, but like my chest is literally on fire on the inside and is like screaming at me with a dull ache that, you know, is extremely depressing. So there's, you know, that's just a couple of the 30 odd symptoms that I've been experiencing.
Mm. And you mentioned to me as well that this has kind of shaped the trajectory of your entire life in possibly the most negative ways, where you've had to change your entire lifestyle. So you've actually moved regionally to help with housing affordability, but as a result, has cut you off from a support network in many ways and isolated you further. So do you mind telling me a bit about how that's been going the past few months?
Yeah, like I was at a crossroads in my life around January, and so the offer to take this little cottage 2 hours away from Adelaide seemed like a great idea at the time. I was like, it's a self-funded residency. That sounds perfect. And I could not find an affordable rental where I could be by myself and still have a pet with me. So, you know, having taken the cottage out here has had the small pro of not being in an urban hub where there's like COVID everywhere. So there's that anxiety is somewhat lessened, but other anxieties are massively heightened. Like my family and friends can't just drop by and like put a care package at the door of food and medication, which would actually be wonderful for the times I'm unable to get up and do the shopping. I felt too unwell and dizzy and uncoordinated this week, for example, to even feel safe driving, and I'll never endanger myself or the people on the road. So this week I've, you know, lived on 2-minute noodles and just made sure that my cat has enough food to eat. So yeah, the isolation and the fear that comes from thinking, God, like if I fall over or have some weird cardiac situation occur, how long will it take for someone to find me? You know, that's been really scary. And really, it's really highlighted to me as well, like the direness of the regional healthcare system, to be totally honest. Like in this recent time, I've had 12 blood tests. I've had an ultrasound on my heart, my liver, my gallbladder, and my kidneys. I've had a cardiac MRI. I've had 6 ECGs. I've had 5 emergency visits to emergency rooms. I've consulted with 7 GPs to date, and I've been dealing with a cardiologist. And then finally, in 2 days, I have an appointment with an immunologist from the clinic that is dealing with COVID adverse patients. And I've waited 4 months for that appointment. So it's been really difficult in the past when I could driving up to 5 hours a day just to see a specialist. And generally speaking, unfortunately, none of those appointments have bore fruit thus far. I can't believe the amount of appointments I've had and still no answers whatsoever. So some days are really hard. The nights are so long when you're not sleeping and your heart just feels like it's going to give out any second. And you just think to yourself, like, is this actually worth it? Like, can I actually keep doing this? Because there hasn't been any help or any like indication of finally being in the direction of sniffing distance of a diagnosis. It's like, where does it end? Is this my life now? And things are just actually getting harder and worse instead of getting better. And that's what concerns me. And that's my actual number one reason for doing this at all and going public with this at all, is just that fear of suffering a silent death from this, and there being no recourse or evidence for my family and friends to get answers about this. Because frankly, like, if this takes me with it, like, I want my community to fucking riot, because my life is worth something, and it's worth, like, all these other people suffering, like, their life is worth something. And this is just really frustrating, and like the hopeless feeling that comes with this. I just have no words. It's the hopelessness that gets in your mind on those long dark nights, you know, of like, when will this end? Yeah.
Yeah.
And will I see my grandparents again?
Yeah, you mentioned that you would go see them every so often and just stay with them in their nursing home. Is that right?
Yes. Yeah. I mean, I've never, never been financially abundant, so I would always just save my money so I could go once or twice a year to Hungary when we traveling nowhere else, just going to Hungary, to their little country town, and spend at least a month each time living in their little care home with them, the smallest little unit you've seen, to the point that my grandpa like sleeps in his lounge room and I would sleep on an air mattress like in the other corner of the lounge room, and we'd be like roomies, and we've the family always says that my grandpa and I have been in love with each other since the day I was born, since we first looked at each other, and we've just been feisty besties ever since. Like, watching the soccer World Cup in the summer in Hungary together remains one of the most precious memories that I have, that we share. And the thing that pushed me over the edge to get the vaccine was the feeling like what we were told, that you wouldn't be able to travel overseas if you didn't get vaccinated. And I thought, that makes sense. And more than anything, that's what I wanted to be able to do, because I was their caregiver, because my 91-year-old grandpa is the sole caregiver to my 82-year-old grandma. And so he needs a caregiver, you know what I mean? Which is why I would travel once or twice a year to support them. So the devastation of speaking to them on Skype and them saying like, we're only holding on to see you, when will you come, is really hard at the moment, because I can't even leave my fucking house. And I want nothing more than to be with them. And trying to reconcile not seeing them again is unspeakable.
And have you found that there have been any kind of supports available via things like Centrelink or government support, or anything you can access to assist during this time where you're unable to work and you're worried about providing shelter for yourself?
Good question. Firstly, there is some small government help that people with COVID, with adverse reactions to the vaccine, can apply for. However, that requires you to have to tick a lot of boxes, which includes having a crispy clean diagnosis and being able to link a lot of things back. So they're really, really stringent about those things. And unfortunately, having just these awful symptoms but no clinical evidence of it prevents me from being able to ask for that kind of support. There was a short time that I was able to get back on JobSeeker for a few weeks, but I found it quite untenable with them constantly wanting me to find work when I'm barely able to get through like the day. And for me, I've just realized that I'm finding that I don't even look at a day like in hours. I'm just trying to get through minute by minute. So I found it genuinely too stressful for the little bit of money that it was. And like, it's shown me such a deep understanding of how low job seeker and government support is, because I'm not even eligible for like disability, because once again, no diagnosis. So complete debilitation doesn't equal disability in the government's eyes in this instance. And and I'm constantly told that I look too well to be as ill as I am, which is also really disrespectful to a whole community, thousands of people suffering worldwide who have, autoimmune diseases or whatever kind of a disability that is genuinely not visible, because majority of illnesses are not. So it's very exhausting to have medical professionals get it so wrong. It's really painful. So to answer your question quite long-windedly, as it were, no, I've not really found myself being able to access much, or if any, support so far.
In terms of this campaign and what we're hoping to achieve with it, how would people donating help you? What would it actually mean for you in a day-to-day sense?
It would just be life-changing to not have to worry about there being a roof over my head. Like, that would just be wonderful, even if that's just for a few weeks or months. And like, how is anyone supposed to find diagnosis or convalesce if they're so worried about just having their most basic needs met? And, you know, just being able to pay off, you know, the medical bills that I've accrued, you know, as well as electricity bills, everything, and just be able to buy some nice groceries for a while and not have to just make sure that my gluttonous pet is fed, and I'll just survive off the gap left, you know, between the money in the account and what her food has cost.
Yeah, thank you so much for taking the time to chat with me and for being so open.
Mm.
Yeah, can't imagine how difficult it must be to relive all this stuff even as you're going through it. Is there anything else in particular that you wanted to I guess emphasize while we're here? I'm just reading through.
Maybe just the idea of how COVID is impacting my life, on top of suffering these weird side effects from the vaccine, because it makes like every single appointment and every single exposure so much scarier. So I've actually been like physically isolating for 4 months, and I went, well, now 5, and like I went 4 months without a hug, which, you know, was still with masks on and with anxiety peaking in my head. But I just honestly needed that comfort, and I needed the support of the one time anyone came up was my dad, like one of the days I got out of hospital, and he just said, I'm going to take the day off and come and clean your kitchen for you, because I hadn't been able to do it in a week. And I cried to him on the phone saying that my house smells like a swamp because my kitchen is so fucking stinky. And that I hadn't had a hug, and that I hadn't had, you know, fresh fruit and veg for like a week. So it was so beautiful, you know. I took the day off, and despite him being tired, etc., and just went shopping and came up and spent 2 hours. I made him wear a mask even inside my house because I was so scared of COVID and whatever I've got going on coupled with that could do, you know. And so yeah, just having the support of like the first hug in 4 months, the first, you know, true contact in 4 months, and just having the mental, emotional and physical support of someone doing that was just worth gold to me. But I just feel like I'm walking this really weird tightrope where people are like, well, why don't you move in with family or move in with friends? And it's just this thing of, yes, I need support, but I also can't risk the exposure at this time. And living with anyone who's not going to be isolating with me 100% of the time would actually put me at risk. So there is no like good solution at this point. And that's why I feel so trapped in this current framework, because it's like, I need help, but how do I get it without putting myself at risk and, you know, having whatever happened to me? So it's just been this shit show of a time, a living nightmare. And it's the fact that I still can see no end to it that is the most devastating about it. While we're still recording, I actually do want to say that probably my biggest fear in being really vulnerable about this is, you know, being branded like an anti-vaxxer, or having my story be weaponized and politicized in this already fraught topic. And I absolutely do not want to be a political pawn that is used for either side or any other cause other than my own, wherein I just want to seek help for myself and other people like me, and maybe have a little bit of support so that I'm not so stressed trying to survive this damn thing. That's literally all I want. And I do not consent to anyone weaponizing my story for any purpose other than my own.